Mr. President, on a separate topic, as President Trump begins his second term, I'm concerned about his immigration policy, pardons for violent insurrectionists of January 6th, and the grifters seeping into the White House. In each of these areas, I'm prepared to fight with every tool at my disposal to stop abuses and that harm Americans. But I also believe we must find areas of agreement where we can. And one of those areas could be addressing the astronomical cost of prescription drugs, a real-life issue facing American families. Thankfully, last week, President Biden announced 15 new drugs that Medicare will now bargain for to lower prices for seniors across America. Remember, those savings are only possible because of the passage of the Inflation Reduction Act, which did not receive a single Republican vote. There's more work to do, though. On average, patients in the United States of America pay four times more than people in similar countries for the exact same drugs. What's going on here? The drug is made in America and sold at 4 times the cost in America as is charged by the same companies overseas. Why is the United States such an outlier? One reason is advertising. Have you noticed any ads for drugs on television lately? If you haven't, you don't have a TV. The United States is one of only 2 industrialized countries in the world that allows pharmaceutical companies to advertise on television. What is the other country that allows this? New Zealand. The United States and New Zealand. You know these ads that I'm talking about, catchy jingles, flashy images, patients rock climbing, swimming, dancing. Big Pharma spends, get this now, $6 billion every year to flood the airways about the latest wonder drug. Why do they spend so darn much money on drug ads? Because it increases their profits. Big Pharma thinks if they can pummel you with enough ads, not only will you be able to spell Xarelto, you'll be able to tell your doctor that this is the blood thinner you've been waiting for. Don't take my word for it. Here's what the American Medical Association says about these ads that we are inundated with every single darn day on our television. Quote, direct-to-consumer advertising inflates demand for new and expensive drugs, even when these drugs may not be appropriate. So when President Biden announced a list of 15 drugs that will be negotiated for discounts, I imagine most Americans already recognize many of their names. Ozempic, Trelegy, Ibrance, Otezla. Manufacturers spend hundreds of millions of dollars encouraging you to just ask your doctor about these drugs. The result? Medicare spends $22 billion last year on those very same 4 drugs that were heavily advertised medications. A recent headline in the New York Times read, and I quote, Robert F. Kennedy wants to ban drug ads on TV. It wouldn't be easy. It discussed the First Amendment challenges that Pharma would raise as a result of that. While I have strong concerns with President Trump's health nominee, I'm glad this administration wants to join me to tackle these promotional ads. We already have a credible strategy on the table. For the last 7 or 8 years, I've introduced bipartisan legislation to crack down on these drug ads on TV and other places. Senator Chuck Grassley, Republican of Iowa, has been my partner. When you turn on the evening news, get this, 1/3 of all commercial time is for prescription drugs. Think you're seeing a lot of ads? 1/3 of all commercial time, prescription drugs. The average American, try to avoid it if you wish, but the average American sees 9 drug ads a day. I'll bet it's more. It seems like more. With billions in targeted spending, patients are bombarded with information. All of this information that is being tossed at you, most of it at a mile a minute gibberish. But they do keep into the darkness one important factor. They never mention the cost, the price of the drug. In 2023, Illinois company AbbVie spent $315 million on TV ads for Rinvoq. I've got a little ad here. You may notice. Rinvoq is an eczema and arthritis drugs. However, in the commercial, they don't tell you one thing. The cost of this drug is $6,100 a month. $6,100. My staff just corrected me before I came to the floor and said, You missed the latest increase. It's now up to $6,400 a month for Rinvoq. Hang on, I'm sure you're going to see one of those ads in no time at all. Senator Grassley and I think it's time to end Big Pharma's secrecy on the cost of these drugs. If they're going to advertise a drug and rattle off gibberish, I love the one that says, don't take Otezla if you're allergic to Otezla. That never would have dawned on me. That's part of their ad. You're looking at these ads and hearing the gibberish they throw at us. They tell you everything under God's green earth except the basic, honest issue. How much does it cost? That's why today we're introducing bipartisan legislation to require price disclosures and direct-to-consumer drug ads. Our plan is simple, and it actually passed the Senate once before in 2018. 88% of American people support this kind of disclosure. In fact, after we worked to advance this measure, Donald Trump, then President of the United States, said, and I want to make sure the quote is accurate, this is from his first term in office, big announcement today, drug companies have to come clean about their prices in TV ads. President Trump said, historic transparency for American patients is here. If drug companies are ashamed of those prices, lower them. Well, I may disagree with the president on many things, but I certainly agree with his statement there. Big Pharma hates being honest with patients about the true price of their drugs. They fear it might cut into their colossal, historic profits. With the support of President Trump, Senator Grassley and I believe that this will be the year we finally pass bipartisan legislation to bring sunshine to these ads and to actually lower health costs. And Mr. President, I yield the floor.